Namaste, I am Dr. Sneha, consultant physician at Care Hospital Banjara Hills. Today I am going to talk about leg cramps. What are the common causes of leg cramps? What are the home remedies which you can do when you get a leg cramp and when to see a physician? What is a leg cramp? It is a painful contraction of the muscle in the leg or the foot. It is commonly seen in the elderly, in pregnancy, and sometimes when there are some certain deficiencies. And there are many causes for common reasons for leg cramps, like excessive exercise in a heat environment, abnormal structural foot abnormalities like flat foot, dehydration, on drugs like excessive use of caffeine, alcohol, patient who is on dialysis, pregnancy where there is magnesium deficiency, iron and calcium deficiencies. So these are the common reasons where you can have leg cramps. Abnormal posturing or sitting in a particular position also can lead to leg cramps. So what do you do when you get a leg cramp at home? The common thing which we advise to do is a stretching of the affected muscle. So suppose if there is a cramp in your calf muscle, so just do stretching of your foot upwards and keep it like that for few seconds and relax. Keep doing it multiple times and your cramp will usually resolve. If it is not resolving with this stretching, then you can stand on the floor flat and lean forward with your hands against the door for few seconds. And you can do it 3 to 5 times in a day so that the symptoms will reduce and you can reduce the frequency later on. The other remedies is taking a hot shower with water on your affected muscle. Pouring the water on that affected muscle will also cause some relaxation of the muscle. Otherwise, you can do ice rubbing with a towel. So these are the common things which we can do, and doing some stationary cycling before sleeping can also decrease the frequency of nighttime cramps. Also avoiding exercise in a heat environment, taking adequate liquids before sleeping and avoiding excessive caffeine. If the leg cramps are recurring, then you need to know what is causing it. So you need to meet a physician if the frequency of leg cramps is increasing day by day in spite of your stretching and there are no other precipitating causes which you know. Then we need to meet a physician where they do certain tests like to know if there is any thyroid disorders like hypothyroidism, deficiencies like calcium, magnesium, iron and vitamin D, or if there are any other structural abnormalities. There are certain medications also to relieve the leg cramps, like giving some B complex vitamins, vitamin E. These are the common corrections with which the leg cramp frequency will definitely come down. If not, there are certain drugs like gabapentin which can relieve the leg cramps to a certain extent.